Hi, my name is Eloy Espin. I am the Chief of Colorectal Surgery Unit of Hospital Valle De Hebron of the Universidad Autonoma de Barcelona in Spain. In Spain, robotics are increasing their presence in several centers. Actually, there are more than 70 centers in Spain that have robot. Some of them have two robots. Our center is going to acquire the third robot in just 2 weeks and a dual console, and it's going to be the only center in Spain with three robots. Several hospitals are acquiring robotics in view of the increased number of indications and advantages of robotics in several specialties: urology, colorectal, bariatrics, ENT, thoracic surgeon, etc., surgery, etc., etc., etc. And also because there's a demand from residents and from new and young surgeons to start acquiring formation in robotics. Our center is one of the centers that was proposed by the ESCP to be certified in the formation of robotics. And actually, we have a fellow, Lina, that comes from UK, that is doing a 6-month fellowship on robotic colorectal surgery. In colorectal surgery, we have a minimum of 3 surgeries every week from robotics, and in the next weeks we will increase this. We are doing, I would say, more than 90% of our rectal tumors by robotics, also the right colon tumors with the D3 dissections, and we also do the ventral rectopexies and tailgut resections and a lot, and we are increasing the number of procedures that we are doing with the robot. And now we are starting also a program of multivisceral resection along with urology. The fellow of robotic, it comes to our unit and shares with us all our activity during all the week. He or she come to the first time in the morning. We do the floor visiting of the patients, and then the fellow goes to all the robotic surgeries and some of other surgeries that are not robotic. And it's also implied in some research and doing some papers about robotics for the unit. We also are also privileged because we have an agreement with Hospital de Hebron with Dr. Biondo and Dr. Kreisler, and our fellow also goes one day every 2 weeks to their hospital to assist to the robotic colorectal robotic surgery program in Hospital de Hebron, which I think increases the number of procedures that the fellowship can attend. In the future, in the next weeks, we will also have the dual console, that it will increase also the easy way to increase the formation in robotic for the fellow. But in nowadays, our fellow is doing assisting and doing rectal procedures, right colon procedures, resection of rectal tumors, and it's all in all the procedures. The fellow is proctored by the staff that has expertise in robotic surgery. And about 10 years ago, we started with the SI. And we did more than 100 procedures in colorectal, but we decided to stop the program of robotics because we didn't see any advantage with the SI in front of our laparoscopic program. But as soon as the hospital acquired the XI, we started again the colorectal robotic program, and we have not abandoned that. In fact, we are now more and more selecting the patients that go to robotics, but selecting the bad patients for laparoscopy. The difficult cases go to robotic instead of going to laparoscopy. We are 6 staff surgeons in the unit, and 3 of us are doing robotic. We don't want to increase the number of staff that go to robotics because we want to to maintain an expertise level, so all the staff that is doing robotic can do at least one procedure every week. This is our target. So as we will increase the number of robotic procedures, we will increase the number of staff that will be having access to our robotic surgery program, because we think that it's better to keep some of the surgeons with robotic access in the way that they can acquire an expertise level in a more safe way for the patients and in a more fast way. We are using robotics because we believe that it's in some procedures it's has a lot of advantages. It's more stable. You can be more precise. The sections you can do, that some of the more complex procedures become more simple for the surgeon, and also more ergonomic. It's not so tiring to do complex cases with robotics that with laparoscopy. We know about the problem of cost, but I think that our task is to explore and to find if there's a role of robotics. The reasons that why we use robotics is that we believe in robotics. We think that there are advantages. When we were using SI, we found that we didn't have any advantage. With the XI, we have advantages. I think that the complex cases are simplified by the way of robotics. It's more ergonomic for the surgeon. And I think that with time we can do that this will become cost effective. But in the way of finding this, I think that university hospitals, the obligation of investing knowledge and trying to find and do research in the new techniques and new advices, new devices that come to colorectal surgery, in order to find if they have a role or not in the day-by-day clinical practice for colorectal surgeons.